every lip is different and unique. For her lip, we are designing a treatment as per her lip anatomy. She has got equal upper and lower lip, which is, I think, quite fantastic. Her cupid bow and the mid zone of the lip is also good. So I divide lip in 3 parts like this, and then this part, right? So we are going to treat the center part. So one is this is second, this is third, and this is the fourth part of the lip, how we'll design the treatment. So this is the arterial supply of the lip. This is the inferior labial, then superior labial, and this gives branches like this. So we have to be careful of the arterial supply. So we are doing a filler for lips, and we have 3 options. Either we use these needles, which are like long needles, or we use a cannula, or we use very short needles and very thin needles. So like these. So I have decanted the filler into these finer needles because I want to be more precise and more to the point on a small structure like lip. This one, or the long cannula or a short needle for the lip, which is my preference, of course the shortest one, to be more precise and to be more to the point, to give the best result with less trauma, no chances of bruising, thinnest and the shortest possible needle for the lips.